Toxicological emergencies, opioids. The Poison Control national phone number is 1-800-222-1222. Toxicological emergencies for synthetic stimulants, natural THC and synthetic THC, and opioids. Effects of synthetic stimulants. One may be psychological. They may experience agitation, insomnia, irritability, dizziness, depression, paranoia, delusions, suicidal thoughts, seizures, and panic attacks. The second may be somatic, effects on the body. They may have hyperthermia, significant with MDMA, rapid heart rate, which can lead to heart attacks and strokes, and chest pains, nosebleeds, sweating, nausea, and vomiting. Bath salts, which may be known as Bliss, Blue Silk, Ivory Wave, White Dove, White Night, or White Lightning, is usually sold as a powder. It's white to off-white in color and can also be sold in a capsule. It is usually inhaled nasally and can also be taken orally, intravenously, or smoked. Methamphetamine, also known as crank, crystal meth, glass, ice, tweak, or yaba, is usually sold as crystals. It's white to off-white in color and has a yellow or red crystalline powder. It's usually smoked, snorted, or injected through IV. MDMA, also known as ecstasy, E, X, XTC, Smarties, Scooby Snacks, or Skittles, are usually sold in tablets or capsules. It can also be sold in liquid drops and can be snorted or smoked, and it can be any color. Natural THC is also called weed, bud, doobie, Mary Jane, pot, blunt, herb, hemp, grass, etc. It's a green to brown or gray mixture of dried, shredded leaves, stems, seeds, and flowers of the hemp plant. It's usually smoked in a cigarette or pipe. Synthetic THC is characterized by mimicking natural THC. It can cause psychosis and is also called K2, Spice, Black Mamba, Bombay Blue, Genie, or Zohai. It is similar appearance to natural THC. Effects of THC may be impaired short-term memory, a decreased concentration and attention, impaired balance and coordination, an increased heart rate and blood pressure, and an increased appetite. Synthetic or semi-synthetic opioids act on the central nervous system as a depressant to decrease the perception of pain, decrease the reaction to pain, and increase pain tolerance. Opioids may be prescribed for acute pain, debilitating pain, or chronic pain as part of palliative care. It may be abused to induce euphoria. Prolonged use may lead to tolerance and/or addiction. Common effects of opioid use may be respiratory depression, drowsiness, constipation, constricted pupils, dry mouth, itching, nausea, and vomiting. Common opioids are heroin, morphine, oxycodone, codeine, fentanyl, Vicodin, Dilaudid, Demerol, and methadone. Treatment for opioid emergencies using naloxone, or also known as Narcan. Check local protocol for authorization at EMT level. It is an opioid antagonist. It reverses CNS and respiratory depression caused by opioid overdose. Not effective against non-opioid drugs. It is available intranasally or auto-injector. First responders and bystanders may have administered prior to EMS arrival. Always ask before administering additional doses. The contradictions are known hypersensitivity to naloxone hydrochloride. Cannabinoid hyperemesis syndrome is a condition that leads to repeated and severe bouts of vomiting. Be aware of patients who experience chronic cannabis use, cyclic episodes of nausea and vomiting, frequent hot bathing associated with cannabis use, and treat findings accordingly.